Hello, thank you for attending this presentation. My name is Dr. Amy Watring, and the title is The Impact of Providing Informal Care to a Cancer Survivor. I just wanted to share an introduction about cancer survivors and caregivers, and I'll begin by stating that as of 2019, there were 17 million cancer survivors in the U.S. Advances in cancer treatment and extended survivals lead to a shift in treatment from inpatient to an outpatient setting. Family caregivers are the silent partners in this, and the healthcare delivery functioning as the de facto care coordinators. An estimated 4.6 million people in the U.S. care for someone with cancer at home, so that is a huge population we are seeing there. Cancer typically results in informal care given by family members, and caregivers of cancer patients providing higher levels of support are more likely to report negative outcomes. So what are the rules of informal caregivers? We can see it can be a family or friend who is not formally trained. They provide personal care, assist with medical care, perform household tasks, arrange for outside services. They could visit regularly and provide assistance with coping. So for the purpose of this study, we wanted to assess the impact of providing informal care to cancer survivors among family caregivers at a cancer institute in Michigan. Additionally, we wanted to assess caregivers' needs for services in programs. The methodology, we used cross-sectional study with purposive sampling to survey respondents regarding the perceived impact of care giving on health, finances, and employment. We also assessed their perceived needs for health information and services for their physical, mental, emotional, and social health. For the survey, we had 6 different sections. We asked them demographics and details about their caregiving, health information needs, healthcare service needs, mental and emotional needs, work and social needs, and then demographics and self-reported impact of caregiving. I will now share with you the results. A total of 63 family caregivers completed the survey. 75% were spouses. 56% reported spending 19 hours or more per week in caregiving. 27% had provided care for more than 7 years, and 21% did not live with the care recipient, so they traveled to visit or to take care. We did see that 20% reported that caregiving caused a negative impact on their employment status or their personal finances, which you can imagine, if you're providing 20 hours of care per week, it can limit the hours of time that you have to work and can definitely impact your finances. When we asked them what their greatest needs were, information on a prognosis from the oncologist. About 50% reported that. They asked for how to discuss their fears of cancer reoccurrence with the recipient, how to help their care recipient deal with changes in their life, how to access supportive services for the care recipient, and seeking emotional support for themselves. As you check out the poster, we also made some graphics for you to look at that put some of this in more detail. We discussed their current health status compared to now versus prior to being a caregiver, the impact of caregiving duties on their employment, how it impacted their personal health and things like that. Again, we asked them how many hours they spent caregiving, and on the chart you can see that, but a large proportion of them were spending more than 20 hours per week. So I'll end by saying our recommendations. Joint services for cancer survivors and caregivers. They need nutrition and exercise programs, support groups, and a discussion about how to manage side effects. Information needs for the prognosis for cancer survivor, perhaps bridge the gap between physicians' lack of time and patience and caregivers' informational needs. And then developing web-based resources accessible on patient portal would be helpful for them as well. So in conclusion, the needs for informal caregivers encompass not only health and wellness needs, but also non-health related aspects like employment and finances. And there is a need for comprehensive cancer survivorship care, which considers and includes informal caregivers as care partners as well as service recipients. Thank you for attending this presentation, and I look forward to any questions or comments you may have. Have a great day.